Very good afternoon to all. My name is Suhaida and I'm from the dental department. Okay, today I'm going to talk about dental services that Khoo Teck Puat Hospital is offering. And before I move on with my slides, can I have a show of hands on who is afraid to see the dentist? As expected. Okay, maybe you have a bad experience of the drilling sounds. Perhaps recently we have a news. I don't want to mention which institution whereby this doctor extracted the wrong tooth because accidentally of the x-ray or folder, something like that. Okay, but fret not, our dental services in Khoo Teck Puat Hospital is top notch. Okay, we are one of the hospital, the best hospital for that serve dentists for dental services. Okay, so my mom always say that to see someone's cleanliness is through the toilet, the house toilet. But for myself, when I choose a husband, I see his tooth. Okay, and lucky thing, he has a nice set of tooth. Okay, because the first thing that you saw a person face, your eye level, for myself, is that I will see the way he smiles. His sets of tooth. Don't care whether he has a denture or implants, bridges, crowns, or whatsoever. As long as he knows how to maintain his tooth, that's all. That's all I need from a man. I mean, aside from other things. Okay? Okay, so I move on with my slides. Sorry? Okay, before I move on with my slides. Okay, this is what I'm going to talk about. Scaling, polishing, fillings, extraction, whitening, denture implants, root canal treatments, crown and bridges, orthodontics, which we call it braces, and also wisdom tooth surgery. Okay. Okay, what is scaling and polishing? At times, I do have patients whereby they mixed up with scaling, polishing, and also whitening. Scaling and polishing is a daily routine which I always advise patients to do it every 6 monthly or even once a year. Okay, the thing is that when we do scaling and polishing is that usually we actually drink coffees, we drink cokes, or even some patients that actually smoke will actually leave a stains on your tooth. And dental plaque is also present in everybody's mouth. If not cleaned properly, it will harden to form calculus. Okay, as you can see in this picture, this is all tartar and calculus, which leads to other problems such as gum periodontal disease. And how often do you have to visit the dentist? Like I said earlier, 6 monthly or even once a year. And be sure to check with your dentist for the best tip to check on your, to improve your oral care and tips on keeping you free from gum diseases. Fillings. Yes, tooth fillings. After a routine dental screening and examination, your dentist may feel that it is necessary to treat and restore any existing decay or fractured tooth. Dentists can also have access to a wide variety of dental materials to choose from to filling their patients' teeth. The most common materials around are amalgam, and also silver fillings or tooth-colored fillings, as you can see over here in this picture. So usually, if you never really do some fillings, right? If you drink cold water, you feel very sensitive. Therefore, you need to have fillings done. Extractions. Usually after your first visit where we had a consultation. Extractions are also offered as a course of treatment, although there are normally other ways a tooth can be saved. If a tooth is extracted, it creates a space that will need to be filled in with either a partial denture, a bridge, or an implant. So, if you don't have if you're not really, do not want to go for any extraction, you can choose to go for a denture. For root canal treatment, which I'm going to elaborate more on the later part. So, usually for extractions, the doctor will give an anesthetic check first. This is what patients always fear. Because when we do normal extractions, patients are wide awake and patients can actually see the surroundings, whatever the doctor is doing, whatever instruments the doctor is holding, and as such, you can see clearly the injection jab. And in fact, I've ever heard my doctor say, okay, I'm going to poke a needle through your gums now. Mentally prepared. So they will use various kinds of instruments to pluck out your tooth. And the worst part is that a normal extraction, if the tooth broke into tooth pieces, it happens because the tooth just refused to come out. What we're going to do is that we will turn it into a surgery, where you will see a trolley, a few of the instruments laid out to proceed with surgery. Whitening. Every one of us starts off with a beautiful white tooth, but strongly colored foods, drinks like coffee, tea, cola, and can discolor the surface of your tooth. After a time, these stains penetrate deep inside the tooth. We do offer bleaching kits for our patients to take home, and as an alternative, you have to be diligent enough to apply these kits every day for a period of 10 days. Usually when you put on, before you go to sleep, you just apply, we will give a set of retainers where you actually apply some of the whitening. You just wear it when you are sleeping. Dentures. Dentures, false tooth are used to replace missing tooth. Complete full dentures replace an entire jaw. Partial dentures replace a few tooth. Alternative to dentures include bridges or implants to replace a few teeth. Okay, as you can see here, these are the dentures. It looks funny, right? But when you wear it, it will look really like a real tooth. Okay, this is bridges. Okay, whereby you have to actually screw into your gums. Implants. I mean, like, if you can afford to have implants done, this is the best choice, because this is fixed through your gums, is not removable. Okay, so dental implants is a popular method to replace missing tooth. A dental implant is a titanium post that is placed into your jawbone and integrates with the bone. And the implant acts in the same way a root acts for a normal tooth. So the function is much more stronger. Root canal treatment. Root canal treatment is something like to remove the infected or damaged pulp from the diseased tooth. After that, the hollow pulp chamber and root canals are cleaned, filled, and sealed. What are the benefits of root canal treatment? Root canal treatment saves tooth that would otherwise be extracted. Some patients choose not to extract the tooth, so they have to go for root canal treatment. And root canal treatment is about $400 to $600, depending. And sometimes the tooth can't be saved. So there's no point to in fact do a root canal treatment. So this is how they're gonna do it. They're gonna dig until you see a hole. They remove the disease, like the nerve. They just remove it, and then it will become a big hole like this. And after which you have to do something like this, that is crowning. A crown is commonly called a cap. It may be thought as a cover or replace that part of the tooth seen in the mouth. Why do a crown? A crown can be done for many reasons. Most often it is done when a tooth is either badly decayed or chipped, discolored or misshaped. Okay? Braces. Okay, somebody just asked me. She has a child and wants to do braces. Okay? What is orthodontics, which we call it as braces? Orthodontics is now a very common sight. One about beautiful smile with that proper maintenance, and it lasts you a whole lifetime. Yes, a whole lifetime. In fact, when you take out your braces, you have to wear your retainers for the rest of your life. Very mafan, I tell you. Want to be pretty? No pain, no gain. What can braces do for me? Braces can do wonders for your self-confidence and also self-esteem. By straightening your tooth, it helps to improve your smile and makes you feel good about yourself and your appearance. There will also be an overall improvement in your dental health, and it will be easier to brush teeth that are well aligned rather than those which are crooked and overcrowded. When should I start wearing braces? General in children or the milk tooth has to come out first. Certainly it is never too old for braces. In fact, we have patients that is 50 years old that still wants to wear braces. But if you have the means, why not? You're never too old to be pretty. How long will the treatment take? It depends on the complication. For myself, for my experience is that I only put braces for 1.5 years, just in time for my wedding. This is my x-ray. And wisdom tooth, which I have actually elaborated yesterday. So for wisdom tooth, usually there's 4. 2 on the left, 2 on the right, and it looks like this. And it's very underneath the gum also, which we need to cut open the gum, and remove it. Why should it be removed? Why do you want to suffer? So the gum around the impacted tooth may trap food, which is going to be very, very painful for you. It will take away your sleep. I've experienced it. My advice to you, take it out. Discomfort may be caused if the upper wisdom tooth bites down on the swollen gum. Tooth decay may be developed, and there's two choices: to remove it under local, where you're awake but your eyes will be covered. General anesthesia will be able to sleep. So again, my question to you: why suffer? So if you would like to know more, make an appointment to see my dentist. Thank you.